Hi, I'm Lisa, your nurse, and I just wanted to talk to you about an important condition that can appear after surgery like you had. We want to avoid it here and after you go home. It's called deep vein thrombosis or DVT. Now, I know the doctor had mentioned it to you briefly, but I wanted to explain in more detail in a way that you can understand. DVT happens when a blood clot forms in one of the deep veins in your body, usually in your leg. A blood clot is when the blood changes from a liquid to a gel and is caused by many different things, but in your case, it is a common occurrence after surgery, especially if you've been resting in bed a lot and not moving around. Some signs and symptoms of DVT to keep an eye out for are swelling in one leg, sometimes both, pain or tenderness, especially in the calf or thigh, warmth or redness over the area, or the leg might even feel tight or heavier than usual. If you notice shortness of breath or chest pain, that's an emergency. It could mean a clot has moved to the lungs, which is called a pulmonary embolism. If that happens, it could be very dangerous and you must contact us immediately. We'll be sending you home with compression stockings. These are tight knee-high socks that help keep the blood flowing and prevent clots from forming. I also want to get you moving. Walking around and some simple exercises is one of the best ways to reduce the risk of DVT. I will get you some information on specific exercises you can do, either sitting or standing. Since the surgery, we've been giving you blood thinners, otherwise known as anticoagulants, in the form of a shot called heparin. It prevents clots from forming. You will go home with a pill called warfarin, which does the same thing, and you don't have to inject yourself. Your primary doctor will take blood from you with a test called prothrombin time to check and make sure it's working and at a safe dose. And a safe dose is taken and it is working well. Some things you should know about warfarin are to take your dose the same time every day before or after eating. If you forget to take your dose and remember within 8 hours of that time, just take it. If it's past 8 hours, wait until the next day and take only the prescribed dose for that day. Do not double the dose. You may experience some side effects. Bleeding is the most common side effect of warfarin. It can appear in many ways, so be sure to call your doctor if you notice any of the following signs. If you feel colder or weaker or looking more pale, those are signs of anemia. Bleeding from cuts that won't stop even after applying pressure for 10 minutes. Bleeding from your nose or gums that won't stop. If you have a fever or illness that gets worse. If you have menstrual bleeding that is heavier or lasts longer than normal. If you have a reddish or rusty colored urine. If your poop looks bright red, black, or tarry. If you're having bruises that appear with no reason or become swollen or painful. Have purplish spots on your skin if you cough up blood or vomit blood. If you have unusual bleeding from hemorrhoids, unusual pain or swelling in your joints. If you have an unusual headache or pain in your belly, sudden changes in your speech or vision, numbness or tingling, dizziness or difficulty breathing. I know this sounds scary, but the risks are minimal if you use caution by using a soft toothbrush, electric razor, and be safe when walking. The good news is DVT is treatable, especially when caught early. If you notice any of these signs I mentioned, don't wait, let us know right away. We are here to help you, and if you have any questions, please don't hesitate to call. Thank you.